My name is Suzanne Puckett, and I'm here today to propose to you a universal healthcare system for the United States of America. The United States healthcare system has been on the political agenda of all parties since the implementation and development of Social Security and Medicare. Political parties have built their campaigns around healthcare reform, including the Democrats, Republicans, and liberals. There are many theories and reforms that have been brought before legislators over the years. The United States of America is leading in the innovative breakthroughs. However, healthcare coverage is not one of those breakthroughs. In comparison with other countries, the U.S. is below average in this area. Other countries provide insurance coverage for all of their citizens from birth. The United States only provides insurance coverage for those who cannot afford their own premiums and out-of-pocket costs, or are military or previous military. There have been many reforms to the America's healthcare system, but not one has clearly provided coverage for all U.S. citizens. Many of those reforms have been developed with the ideas of insurance coverage for all, but have not been successful. In this proposal, we will ask questions that show just how important it is to the public's health that government universal health care coverage be implemented. How many citizens are uninsured? Which people groups are most affected? If Medicaid was expanded in each state to provide insurance coverage for the uninsured, would preventative care increase? If citizens had insurance coverage, would the public's overall health improve due to those preventative care services? Beland, Rocco, and Walden compares the theories and reforms attempted by the different political parties to decrease the number of uninsured in the United States in their article, Obamacare and the Politics of Universal Health Insurance Coverage in the United States. Healthcare reforms often tackle cost control and insurance coverage. Presidents have implemented many reforms and programs. For example, in the 60s, the Medicare and Medicaid programs were established. Since these programs were established, the most popular health reform has been PPACA, or the Patient Protection and Affordable Care Act, also known as Obamacare. Even though the goals of PPACA were never to establish a universal coverage system, many thought it would decrease the amount of uninsured citizens in the United States substantially. The Congressional Budget Office predicted that 30 million Americans would gain insurance coverage. Even if this prediction came to pass, there were still going to be 23 million people uninsured. PPACA did increase the availability of insurance to its citizens through their health exchange, but individual states let the ball drop and the federal government was not prepared. The Medicaid program was to be expanded so that low-income families would be eligible for insurance coverage if they made less than 138% of the federal poverty limit. Many states refused to implement it. Even though the projected numbers were lower than expected, PPACA had many positive features, like Medicaid expansion would allow for more accessibility for the insurance. Insurance would be blocked from discriminating against high-risk patients. Children under the age of 26 could be covered by their parents' insurance. Insurers could not refuse to cover people with pre-existing conditions. Insurers could not impose caps on their payments. And penalties would be given to those without insurance coverage or to employers that did not offer insurance coverage. With all of these positive features, why was universal coverage left out? There are many theories why the U.S. is so against universal coverage. One of those theories is that the government should not be involved that closely with the healthcare industry. However, that argument is not fallible. When Medicare, a government insurance, regulates all healthcare in America. Another theory is the amount of politics that will tear up any reforms introduced. Political parties have tried to pass healthcare reforms to this degree, but due to other reforms attached to the bill, they have failed to win the vote for the establishment and implementation. Other parties have voiced that to implement such an intense medical reform is a political risk that they are not willing to take. Democrats, like President Bill Clinton, has refused to quit on healthcare reform until all citizens were insured. Under Obama's plan, individuals would receive a tax credit if they did not have an employer-based insurance plan, which they could use to purchase their own plan. Obama put the responsibility back on the employer to offer insurance coverage and then on the insurer to eliminate discrimination towards pre-existing conditions. Republicans lean towards goals from the Health Americans Act, a bipartisan bill that offered tax credits and subsidies to individuals to purchase insurance instead of employer-sponsored insurance coverage. This act would also establish free coverage to citizens living at less than 100% of the federal poverty limit, instead of using an expanded Medicaid plan. Even though this plan was bipartisan, made up of both Democrat and Republican supporters, liberals were not attracted to this bill. Leftists and academic leaders developed the public option. This gave the government a chance to compete with private insurance companies, but providing a government insurance option for purchase by the uninsured. This option would have been a type of a universal plan. After the implementation of PPACA, the projected 30 million citizens that would become insured did not show true with the Census Bureau report of 10.4% of people in the United States were uninsured. That's 33 million people without insurance. The Department of Health and Human Services reported that between 2013 and 2015, the uninsured African Americans declined by 10%, Hispanics declined 11.5%, and whites declined by 6%. Had all the states expanded their Medicaid program, these percentages would be substantially different. The Supreme Court decided that forcing states to implement this expansion was beyond the federal control. By January 2014, 24 states were not participating in the expanded Medicaid program. As we can see, there are many variables to why universal insurance coverage has not been established in the United States. The represented political groups have different theories on a universal coverage and what it would entail. PPACA has been a positive impact for the uninsured, but there is still a large population of uninsured in the United States. Who are the uninsured? What population groups are included in the uninsured population? Well, the Kaiser Family Foundation website shows that most of the uninsured people are made up of low-income families that have at least one worker in the family, non-elderly adults, and people of color, who have a higher risk of being uninsured. The non-elderly uninsured adults are made up of 44% non-Hispanic whites and 42% people of color. In 2016, the uninsured non-elderly adults said the reason they did not have insurance is because the cost was too high. The uninsured citizens are less likely to have access to care than the insured. In 2016, 1 out of 5 uninsured went without medical care because of the cost. Financially, uninsured have twice as much difficulty paying for medical bills than the insured population. In 2016, the lowest uninsured rates for non-elderly adults reached 10.3%. In states that did not expand the Medicaid program, there are a higher percentage of uninsured citizens than those states that did expand the eligibility limits. The reasons for being uninsured include the following. The uninsured non-elderly adults said they were uninsured because the person who carried the insurance lost or changed jobs. The uninsured non-elderly adults works for an employer that does not offer insurance. They lost Medicaid coverage due to an increase in the income. There was a family status change, married, maybe divorced or separated. Part of the coverage gap. These people that were in the coverage gap earned too much to qualify for Medicaid, but not enough to qualify for the marketplace premium tax credits. Undocumented immigrants are ineligible for coverage, while those that have not passed the 5-year waiting period, immigratory status does not qualify for Medicaid. Uninsured citizens also vary by geographical location. Those that live in western and southern states are less likely to have insurance coverage than the north and the east. 17% are uninsured in Texas, 14.6% in Florida, and 14% in Arizona. Income levels also show a difference in uninsured citizens, with 50.8% for those making more than $40,000 a year are uninsured. Those at the poverty level of 200 to 400% account for 31.4% uninsured. The single adult living alone account for 24.5% of the uninsured, and families with 2 parents and a child make up 19.9%. Families made up of And families made up of one full-time worker make up 49.9% uninsured, while two full-time worker families make up 24.8%. What effect does being uninsured have on your health? People without medical care coverage are less likely to have an outpatient preventative care. Without preventative care, patients are more likely to end up in an emergency room setting for preventable issues. Those health issues could end up with such severe outcomes that the patient is then admitted to the hospital, where the cost is then increased, resulting in unpaid hospital bills. Many times, when the patient is admitted, they refuse the needed diagnostic tests and other procedures due to the high cost. Unpaid medical bills are the leading cause of bankruptcy in the United States. Patients who do not have insurance coverage are oftentimes covered under charity care, which results in increased medical care costs to those that are insured. The KFF.org reports that research shows that obtaining health insurance improves health, that health insurance improves access to health care, which improves health outcomes. Under one universal insurance plan that covers all preventative care, health outcomes would be decreased, which would increase. Unhealthy outcomes would be decreased, which would increase the overall public health of the United States, thus minimizing the financial burden on the insured from increased medical service cost. United States healthcare versus universal healthcare of other countries. In most European countries, like Canada and Japan, citizens have a universal health plan from birth. This healthcare coverage is a basic plan, and citizens can choose to purchase additional health insurance as they see fit. In America, there is a multi-tiered system made up of government, private, and personal insurance coverages. There are government insurance plans for the elderly, disabled, and low-income citizens. In universal healthcare countries, there is a single-payer system where the government pays for healthcare costs. In these universal insurance countries, they do have higher tax costs, but these taxes go towards the cost of the insurance coverage. For cost, the United States is comparably higher with $8,000 for the average cost, while other countries are an average of $3,000. Some may say that the United States have better health outcomes, which is why it costs so much more, but it is proven that these other countries have the same, if not better, health outcomes. In closing, although we cannot blame the United States public health status on a lack of insurance for all its citizens, we can clearly see that the benefits of preventative care provided by this type of insurance would clearly improve the health of the uninsured. In closing, regardless of what party you are affiliated with, there is a clear picture of an unhealthy population in the United States. It is also clear to see that a universal insurance plan for all United States citizens would provide for preventative care and treatment that would increase the health outcomes of our people. The overall public health of this nation is at a breaking point, and if we do not seriously plan for our country's medical future, it will be too late to recoup. In addition to the medical reforms that have been established, we must take a look at the resources that are available to ensure the uninsured of this great nation. I propose using an existing government program, Medicaid, to provide health insurance coverage for all American citizens. This existing program would simply need to be expanded to include all income levels to provide basic medical coverage. Those that have income to support additional insurance coverage could purchase supplemental plans. Using this program could eliminate the need for employer-based insurance plans. An increase on taxes, like other countries, could be utilized to pay for basic insurance coverage for all citizens. Taxing all for the coverage for all would not place a financial burden on those that can afford their own insurance plans. It is very important that we grasp a hold of this universal health coverage throughout all political parties so that we can improve the public health of the United States of America. Thank you.